It has been less than 3 months since Governor Reynolds submitted Iowa's application for hundreds of millions of dollars in federal funding to improve health care in the rural parts of our state.
KCCI Investigates learned Iowa's Healthy Hometowns proposal was approved in late December. The first chunk of change, more than $200 million. A chunk of that will help provide tens of thousands of Iowans with resources to protect themselves from one of the leading known causes of cancer in our state. What if, for the same cost of a movie ticket, you could take the first step in protecting yourself from a real-life villain? A radioactive gas that kills 400 Iowans every year.
Radon testing is cheap, costs like $15.
But State Representative Dr. Austin Bates says most Iowans don't do it.
The data show that 70% of Iowa homes have an elevated radon level, yet probably only 1 in 10 have checked in the last decade.
So the big question is why? Do you feel most Iowans are aware of the risk that radon poses?
I think the kind of unique consistency and characteristics of radon make it less likely for people to be aware of that just because it's odorless. You know, it's happening in the background, and we don't necessarily know that we're always exposed to that.
Dr. Robert Cruz, the medical director for Iowa Health and Human Services, says Iowans might also not know you need to test your home more than once.
US EPA recommends every 2 years that we test for it regardless of effects.
But the fear of what happens after you test could be contributing to the problem too.
The cost of mitigation certainly is a barrier for people even wanting to test.
Experts say a system installed by a certified specialist is at least $1,000.
For some folks, ignorance is bliss.
And in large parts of our state, access to a specialist is limited. According to HHS, there are currently 90 that provide services to Iowa. That means large swaths of rural Iowa, which according to the governor is home to nearly 50% of our state's population, don't have any.
If you were living in Northwest Iowa, the closest person to you is somewhere in Des Moines.
The Iowa Environmental Council, a nonprofit, nonpartisan alliance that works to protect and preserve Iowa's environment, says their research shows people in all corners who know about radon worry about the risk.
We didn't start with any one pollutant in mind. We didn't start with any one outcome other than we wanted to protect the health of Iowans.
So they held listening sessions in these 15 different cities and towns across our state. And beforehand sent out this survey, asking folks which risk factors of cancer concern them most. It included smoking, diet, alcohol consumption, exercise, and physical activity, all listed in the state's cancer plan. They also added 5 environmental factors tied to cancer, including indoor air pollution and radon.
All of the top 5 categories were the ones we added in. Not diet and exercise, not smoking, not genetics or HPV vaccinations, all the things we already know a lot about. Not even smoking, right? It was all of these environmental risk factors.
Cody Smith is a candidate in Iowa House District 33, but in his capacity as the Director of Climate Initiatives at the IEC, has done a deep dive on radon and says findings on the radioactive gas will make up 16 pages of its environmental risk factors report, which will be released soon. But there's already optimism about the impact of the state's Healthy Hometowns proposal, which was greenlit last month.
A significant chunk of that is towards cancer prevention. Inside of that is radon testing and mitigation specifically.
During the governor's Condition of the State address, she said the plan was awarded $209 million for year 1 of the 5-year federal rural health transformation program.
Just this year, more than $50 million will be invested specifically in cancer prevention.
HHS tells KCCI that'll include 30,000 radon tests and mitigation for 500 homes. That's more than 20 times the number of tests the legislature approved last year.
Those tests were completely gone through in 2 months.
And Will says 500 homes is shy of the 2,500 they estimated would be mitigated when the House passed a $1,000 tax credit that the state Senate didn't take up last year. But
I think we need to make sure when we do the tax credit that it's quite honestly substantial enough if we do it, because some homes will be $1,000 or $2,000 or $3,000 and others could be much, much more. So let's get a head start with the 500 a year.
And that
you have to have the services in place, and that's not going to happen tomorrow.
That's why the state's plan also provides training to certify mitigation specialists in areas of our state that don't have them.
I think we have a lot of smart, skilled people in the state of Iowa who can fill that need.
It's as simple as, quite honestly, getting the training and putting it with an HVAC company, which I would say most of rural Iowa has an HVAC opportunity within their realm. So then how do you get the training? Are we using a community college? colleges. Those kind of answers need to be found.
The problem is very real. Radon-caused lung cancer is estimated to have killed nearly 150 more Iowans than died in accidents on our roads last year. Now, help is on the way to stop it from taking more lives, from prematurely ending more of our real-life stories.
And HHS tells me they'll have more information regarding their partners for these initiatives by early March and eligibility criteria after that. So something, of course, we will continue to follow.